And then also there's a significant decrease in the skeletal impact on a treadmill versus over ground. And this is largely attributed to the flexible treadmill development construction of the treadmill. A lot of home units will, as you guys might know, they advertise with treadmills that have a little flex in it to reduce the ground reaction forces. And these articles attribute to this differences in the skeletal impact or the ground reaction forces to a little bit to how we land. We land with typically more of a flat foot on a treadmill, and then we have a decreased vertical displacement like I talked about earlier. Again, the landing with the flat foot I think comes back to more the decrease in stride length and the quicker stride frequency. So if I'm taking a shorter stride here, I'm going to land less on my heel and a little more on my midfoot. And that's going to help impact some of the ground reaction forces. And also there's a Milgram study back in 2003. This was a university in Israel. What they did, they took these three poor grad students, and what they did in the morning, they surgically inserted a staple strain gauge along the length of their tibia in the morning. They did all these running studies, and in the afternoon they sent them back to the OR and got them surgically taken out. So pretty intense, but it said in an article that they're able to get back to their normal activity in 10 days. So those poor grad students. But so anyway, they found that there is significantly less tibial stress on treadmill running versus over ground. And they found anywhere between like 45% and 285% less on the treadmill versus over ground. And so that's big. And then the authors kind of stated that he may be achieving less tibial bone strengthening. So bones, they kind of they align along the strength or along the lines of stresses. And so we need some weight-bearing activity to increase our bone density. And I think on a treadmill running, you're going to get enough that I don't think it's going to significantly impact that. And that's just something they threw out there. But the big results from that study is that there's quite a bit less ground reaction forces on treadmill running. And then there's some metabolic differences, and research does differ on this quite a bit. The big study, this Jones study, is what, if you pick up a Runner's World or go online, a lot of people, they're all going to say, put the treadmill at 1% incline to stimulate over ground running. And this largely comes from this Jones article. Anything before that was mostly just guessing. Because what they did here is that they ran someone for 5 minutes, I think they had 10 or 13 people that ran for 5 minutes over ground, and then they ran for 5 minutes at a 0, 1, 2, 3, 4, and 5% incline on the treadmill. And they found that it was metabolically equivalent, or so the oxygen uptake was equivalent to between a 1 and 2% grade. And then the obvious differences in the environment. There's no headwind and tailwind and crosswind on a treadmill, of course. There's no downhill. So that's a big one if you're training for the Colorado Marathon. It's much easier to maintain a fixed pace on a treadmill. Otherwise, I guess you'll fall off. And then some of the benefits that you can really catch up on the news or Sports Center. In case you have a physical therapist here, almost every lunch break she runs out there and watches Sports Center, and that's her way of just, relaxing. And then you can also catch up on American Idol, things like that. If you're like my mom, you'll do that. So whenever we talk about the research, we got to talk about some limitations. The big limitation that there is relatively few runners with each study. With all the ones I looked at, they all had between about 3 and 25 participants in it. It's a pretty low number. They didn't really account for differences in running styles, which would be interesting. They didn't look at the chi running and natural running and barefoot running and things like that. Although when I was talking to my biomechanics professor last Friday, they just came out with a report, or they just published an article, and they looked at the metabolic differences between barefoot running and shoe running. And I don't know if it's published yet, but he said that it's slightly more efficient to run with shoes on. So that's kind of interesting. So you get a little bit some elastic energy from your shoes, I guess. And then, as we know in the healthcare field, and as we're learning more and more, is that muscles are very dynamic tissue, and inhibition and activation will change pretty quickly depending on what you're doing, what positions you've been in all day with different injuries and things like that. We don't really know how that affects the EMG readings. That's a couple years down the road, I think. And so to put it all together here, to kind of recap, there's going to be similar cardiovascular benefits between the two. If you remember back in the 2000 marathon trials, Christine Clark won on the female side. This was this is kind of a cool story because she just came out of nowhere. No one heard of her, and she came and won. She's a pathologist from somewhere in Alaska. And the big story was that she did most of her training on the treadmill. She ran 60 to 70 miles a week on a treadmill in her basement to prepare for the trials. And she came out of nowhere and won. It's kind of a cool story. Well, what they also talked about is that she had a lot of plantar fasciitis leading up to the race. And I don't know Christine or anything, and it'd be fun to test her, but I'd be willing to bet it'd be related to that increase in that calf muscle activity, or the gastroc soleus. So if we were to look at a cadaver or peel away someone's skin on their calf here, we'd see the gastroc soleus muscle complex blend into the Achilles tendon, and that blends right into that plantar fascia. It's all just one continuous band of tissue. So if I'm increasing the stress on my calf a lot, that's going to increase the stress on my plantar fascia. So again, I don't know her much, but I think it could be related. I don't know her at all, but it could be related to the activity on the treadmill, the increased gastroc soleus activity. And so this is a big one. There's the increase in hamstring activity from that quicker, shorter stride. Again, the hamstring working to slow my foot from swinging forward here. And that's a big one when we see people doing a lot of training on the treadmill and they go out and run over ground, they're going to be using their hamstrings a lot. And that's kind of related to the decrease in glute activity, which we'll talk about in just a sec. And there's also the increase in hip extension, so the treadmill belt is pulling my leg back, increasing that hip extension, potentially increasing the stress on my low back because I'm going into extension here. And then it puts a potential strain on that lumbar spine. And then also, this is a big one, along with the increased hamstring activity, there's a decrease in glute activity because, again, that treadmill belt is doing the work of my big glute muscle back here. It's pulling the leg back for me. So over ground running, I'm using my glute muscle to pull my leg back and push me forward. And that's a big one. That's when we'll see a lot of the hamstring tightness and strains when people who do a lot of treadmill running and then go over ground because butt muscle isn't working right, hamstrings are working overtime, calves are working overtime. And that's, glute muscle is a big muscle for propulsion like I talked about, and for pelvic stabilizer and the spine stabilizer. So what should you do? So if you're training for a run or a race outside, the best recommendation is run outside. If you can, if you're in Colorado and one day it's 2 degrees out and the next day it's 60, alternate some of your training. Try to get outside if you can. And do simulate some downhill running if you're doing the Colorado Marathon or the half marathon where there's going to be a lot of downhill. And then again, if you're doing a lot of treadmill running, make sure the glute complex is strong and active. We see a lot of that with our runners in the clinic here.
If you don't do the downhill running, what should you be doing, especially for the Colorado Marathon with a lot of downhill? What's different on downhill versus flat?
Yeah, so with downhill, we're going to use a lot more of the eccentric activity through our quads and the muscle in the front of our shin, the anterior tib. And so if you're doing a lot of treadmill running, it's hard to replicate. And so I think the soreness that you'll experience will definitely be higher if you're not used to that downhill running, and just the stresses on your bones are going to be more from all that eccentric activity. And then so making sure the glute complex is strong and active. And so just some quick advice to stay active or to stay healthy and active and keep running is just one of these simple tests that I wanted to throw out there that I even have my runners and patients do to see, make sure things are working right. One is just the glute squeeze. See if you can do a glute squeeze. Tighten your seats together without really tightening your legs and your calves. So if you do, and I put it standing, lying down, so do it in different positions. If you do a glute squeeze and you just feel your calves or hamstrings tighten up, then there's some muscle inhibition going on. There's muscles that aren't quite working right with those glutes. And you can even do one side versus the other and compare both sides. And then I put a prone hip extension test. So lie on your stomach, lie on your bed, and just lift your leg up. You can see what kicks in first. Ideally, it should be that big butt muscle should be doing that motion. A lot of people, they'll be feeling their hamstring and their back really trying to do that. And that just means there's just muscles aren't connecting real well. And then watch for asymmetries. This is a big deal too. If you're doing those glute squeezes back and forth and one tightens real hard, the other you can't find or it's just not there, then there's some kind of asymmetry going on. And then the sitting hip internal rotation, if you just sit on a chair and kind of kick both feet out to the side, if one leg goes like just a little bit, the other leg almost kicks you in the face, then there's some serious asymmetries. You're kind of running on a crooked frame. And so that's a big deal too. And then probably the best way to stay healthy and just keep running is come back in 3 weeks, because they're going to talk a lot more about this. So we got Brad Owner, Rebound, great physical therapist, and Dr. Thomas Hecker, like Brad talked about. I think Brad just told me he's talking in Germany in April or something. So
in July, a World Symposium, got invited to come and talk because the medical world heard that he's practicing differently. He's not just looking for what's broken or torn and then saying, oh, by the way, you're running 4 days a week, why don't you quit running and you'll feel better. He doesn't practice that way, and he really works proactively with people and does a good job of that.
So yeah, we get him right here in Fort Collins.
Yep.
3 weeks.
Greg's test up here, the one, folks, where it talked about the asymmetries. If you look at your front page of what was sitting on your chair, down at the bottom, if you go to that part where it says to view several self-tests that you can do at home, those are tests. They aren't perfect. They're not what we would do in the clinic, but they are tests that can kind of give you an indication of a significant asymmetry. And we'll see people who are perfectly fine running at 15, 20, 30 miles a week, and when they bump up, sometimes the car frame gets knocked out of alignment, and then all of a sudden, now those tests are asymmetrical, and that's our indicator. So those of you that have worked with us here are probably familiar with those, but that's something you can do just on yourself, or even a friend a long distance away is route them to this and have them compare both sides and kind of see what those tests indicate. Okay. Also, we included some articles, just some other information. There's a blank page for some notes. And then as we get toward the end of tonight, if you take just a moment and fill out the survey, we'd sure appreciate to get your feedback on how we can keep these things going and give you good information. Any questions for Craig?
Yeah.
And I apologize, we walked in late, so you may have covered this already in your first 5 minutes. What about, I mean, obviously to me, I enjoy running outside more, it's just more enjoyable. What about the temperature? I mean, when is it detrimental to run outside versus do the benefits of running outside outweigh any temperature drop?
Good question. Yeah. As far as like cardiovascular benefit and all, or just where it's dangerous.
Just the cold, dangerous, your body's cold, kind of shivering, or
yeah.
until you pull out.
Yeah, that's a good question. I think it depends a lot on what you're wearing. Make sure the hands and you have good socks on, good gloves, good hat, and the good running material. That plays a big role. But as far as our lungs tolerance to cold, that's going to be different for a lot of people. If you have any asthmatic reactions and things like that, but
I don't think there's been any conclusive research on that. It's certainly a comfortability factor, you know, of your straining. You can feel your system is on stress when it's at a certain temperature. You just feel like I shouldn't be out here. I'm scheduled to do 5, and I think I'll just do 2 today. I mean, that obviously tells you that your system is that way. But I've got some people who seem to be just totally fine heading out the door at 2 degrees outside, and they're very comfortable. I've not seen any research that supports, I think it's a perception
yeah,
for an
it's
individual.
very individual. Yeah.
So you talked about the